Are you or do you know someone recovering from COVID-19? Let's talk about how Emerson's COVID recovery program helps people regain their physical and cognitive abilities with Matt O'Connor and Kristen Wood. Both are staff physical therapists at Emerson's Clough Family Center for Rehabilitative and Sports Therapies. This is Health Works Here, the podcast from Emerson Hospital. I'm Bill Klaproth. Matt and Kristen, thank you so much for your time. Matt, what were you doing working in the hospital during the surge of the pandemic? Can you share some stories about a typical 12-hour shift?
Yeah, so we worked as patient care techs, basically the same job as a nursing assistant or a personal care assistant in the hospital, and our jobs there fell under two major categories. One was direct patient care. Every 4 hours, we would go into patients' rooms. We would take vitals, check on patients to see if they needed anything, help patients to the bathroom if they needed it. For those patients that were at higher risk for falls, they would often be on a bed alarm. So as soon as that alarm goes off, one of us would be rushing in there, fully gowned up, there to help them just in case anything happened. The second big category of jobs that we had were more related to patient communication. Because of the isolation required by the COVID diagnosis, a lot of these patients couldn't really talk to their families. So we would often set up either a Zoom call or a Skype call or help patients text their families or call their families to make sure that they could keep some pretty consistent updates with those people who they, previously saw all the time.
Wow, I'm sure you experienced and witnessed things you thought you might never see. So, Kristen, can you talk about how COVID affects people, some of the primary medical conditions you saw among patients?
Yeah, so the big thing was how it affected their oxygen levels in their blood. So normally 92 to 100% on the air we breathe would be in a normal range, but a lot of times their oxygen levels would drop below 92, so they would have to have some supplemental oxygen at high levels at times. So this would create some shortness of breath, which even rolling over in bed could get the patient short of breath, or sitting up on the edge of the bed, they were short of breath, and even walking to the bathroom, they were really having to struggle. We also saw elevated heart rates. So with minimal effort, they were just really struggling with having to breathe.
And Matt, now that you're both back working as physical therapists in an outpatient setting, how has your experience treating patients with COVID in the hospital impacted your work?
It's definitely changed the focus, or at least refocused our practice a lot into patient education. And the first and foremost being the big three strategies that every major health organization has endorsed, namely wearing masks, washing your hands, and keeping 6 feet apart from everybody else. I think I probably have a conversation similar to that with every new patient I have, and often again in subsequent follow-ups. But the biggest way it's changed my actual job day to day is, in order to reduce the frequency of exposure for a lot of these patients, we've instituted a really great telehealth program to allow for people to have physical therapy specifically in their house. So they're on a laptop with a webcam, they're on an iPhone with a camera, they're on a tablet that has a camera, and we can talk through exercises with the patients. We can educate them about things they can do to mitigate some of their pain. It's been eye-opening because it's changed a lot of our job from quote-unquote fixing people and telling them what to do when they're in the clinic to now fostering this certain level of independence when they come in. So it's changed from do this, do that, to this is how you can do this better, and this is how you can manage this when you're at home, and if this comes up, this is what you should do about it. And it's actually been really great because it creates a sense of independence in the patient themselves, and it teaches them how to manage things on their own if things come up in the future.
So fostering a level of independence. So Kristen, is this what inspired the creation of the COVID recovery program at Emerson's Rehabilitative and Sports Therapy Center? And what are some of the goals of the program?
So we realized that working with the COVID patients in the hospital, that they were going to have a really tough time getting back to their regular activities. So we saw them at possibly their worst, and they're dealing with shortness of breath, with walking 10 feet, the elevated heart rates. So once those patients are discharged home, they don't just magically get better. They're still recovering. Whether it's someone who wants to get back to helping care for their grandchildren, walking up that flight of stairs to their bedroom, getting back to being able to go to the grocery store, we can help make a program that we can monitor their vitals with, that we can start with some graded exercise programs. And really the goal is to help return them to their prior level of functioning in a safe way and get them on a nice home exercise program that they can continue to increase their activity safely. And we know where they're starting from since we were there on the acute side.
I'm so glad we're talking about this because we hear so much about COVID-19 patients, but not a lot about the patients that have recovered and still some of the struggles and things that they're going through. So it's great that we're talking about this. And Matt, what are some of the key lessons then you've learned from your work caring for patients in the hospital, and how does that inform your work as outpatient physical therapists?
By far the biggest thing that we took from it was just the sense of perspective that we got. It's a scary thing to be in the middle of a pandemic and to have to isolate inside your home, and for the options that you had socially and physically and mentally outside of your home have disappeared. But for those people that were unfortunate enough to get COVID-19 and be hospitalized, it's that much scarier because the symptoms that you're getting feel confusing and they feel unknown, and it's so much harder to solve a problem when you can't really understand its basic components. And the one huge thing that we've taken is seeing this big range of symptom presentations from those people who seemed like when they were hospitalized had a really severe flu, to those people who, like Kristen was saying, could barely roll over in bed, or lifting a glass of water to their mouth was enough work that they needed to rest for a few minutes afterwards. It really adds to the sense of empathy that we have seen what it does to every person and the range of symptoms and just how badly people's lives have been affected. And it really is a huge motivating factor for patients coming into the clinic and for ourselves as well to know where they were at their lowest point and what they need to do to get back to their highest point.
This has given you both unique perspective, being there on the acute side and now on the recovery side. And Kristen, I imagine this has got to be very satisfying, seeing both of those ends and now helping these people recover.
Yes, it is very satisfying. It was hard at times, but it was very rewarding.
Yeah, no doubt about that. Well, Kristen and Matt, thank you so much for your time. This has really been great. Thanks again.
Thank you.
Thank you very much for having us on.
That's Matt O'Connor and Kristen Wood. And please visit emersonhospital.org/COVID recovery or call 978-287-8200 for information on Emerson's COVID recovery program and to schedule an appointment. And thanks for listening to Emerson's Health Works Here podcast. Subscribe to this podcast on your favorite podcast source, including Apple Podcasts, Google Play, and Spotify. And if you found this podcast helpful, please share it on your social channels and be sure to check out the full podcast library for topics of interest to you. This is Health Works Here from Emerson Hospital. Thanks for listening.